How do I know if a staring spell is ADHD or an absence seizure?
This is an excellent question that I think isn't asked enough, probably. ADHD, or attention deficit hyperactivity disorder, is a rather common neurological condition that is diagnosed in the pediatrician's office, is diagnosed in the schools, and is really a child not paying enough attention and staying on task, and in two or more different environments, so school and home, for example. So we know it's not just environmental and behavioral, and may need treatment with medications like stimulant. But there could be children that are identified as daydreaming and not paying attention, and labeled as having attention deficit hyperactivity disorder, or evaluated for that first, when in fact they may be having very short seizures. Absence seizures mean, just like it sounds, absent. This is a type of generalized seizure that comes from both sides of the brain at once. They're very short, so can last about 5-10 seconds. There may be some associated eye fluttering, or maybe not. And usually the child will just stop what they're doing. Like if they're eating some cereal or something, they might just stop for 5 seconds and then to carry on with the spoon. Or if they're in class, they would be looking at the teacher and look like they're paying attention, but would stop listening for those 5 seconds, miss whatever instruction was given, like if they're asked a question, for example, and just when they come to, they would seem like they weren't paying attention or ignoring the teacher. So could be labeled as having ADHD. So a doctor, pediatrician, or a neurologist might think about ordering an EEG in the evaluation of ADHD if there is some reports that sound like they could be absence seizures. There have been studies done that show that a certain proportion of children who are evaluated for ADHD did in fact have absence seizures or some other EEG abnormality. So often this is handled in the pediatrician's office, as I said, or a psychiatrist's office, and neurologists might be more comfortable ordering EEG, but this is something that parents might want to ask: does my child need an EEG to evaluate for other causes, especially if the treatment's not working for the ADHD?